Hello, my name is Megan Bernardo. I am an undergraduate student at the University of Nevada, Reno, and I have been interning at the Nevada Division of Public and Behavioral Health, also known as DPBH. My project has been based off the Synar Amendment. At my internship, I developed a strategic plan with DPBH staff and tobacco control coalitions to more effectively implement the Synar Amendment in the state of Nevada. To evaluate the effectiveness of the Synar Amendment, one of my preceptors and I conducted a linear regression study on the implementation of Synar as shown by our retail violation rates, RVR percentages, and youth tobacco use shown through the categories of lifetime cigarette use and lifetime vapor product use on the Nevada Youth Risk Behavioral Surveillance Survey, or YRBSS. I have been working for youth. DPBH is within the Department of Health and Human Services, DHHS. The mission of DPBH is to protect, promote, and improve behavioral and physical health of all the people in Nevada. DPBH has a variety of different programs. My internship office is within the Bureau of Behavioral Health and Wellness within the Substance Abuse Prevention and Treatment Agency. In 1992, the Synar Amendment to the Alcohol, Drug, and Mental Health Reorganization Act was enacted as a means to prevent youth tobacco use. A way this is done is through conducting retail store inspections to prevent youth from having access to tobacco products. The block grant Synar receives comes from the Substance Abuse and Mental Health Services Administration, or SAMHSA. All states are required by SAMHSA to submit an annual Synar report, ASR, by the 26th of each year, which evaluates the inspections conducted through Synar. The ASR measures the RVR percentage in 2019. The federal public law 1694, also known as Tobacco 21 or T21, was passed, raising the legal age of tobacco sales from 18 to 21 nationwide, and it went into effect immediately. Nevada has until 2022 to implement Tobacco 21. As of May 2021, the legal age of tobacco sales in Nevada is 18. In Nevada, during the 2021 legislative session, AB 59 was proposed as a way to implement T21 in Nevada. So far, it's still in the process of going through the legislative session, and it is currently in the Senate. After working on the strategic plan for 6 months, creating objectives for the goals and doing a logic model, we decided to conduct a linear regression. We used Excel to provide a chart of the RVR percentage and YRBSS prevalence data for lifetime cigarette and vaping product use to depict odd-year trend lines. We conducted a linear regression using EPI software to compare Synar Amendment RVR percentages with the percentages of lifetime cigarette use and lifetime paper product use on the YRBSS from 1999 to 2019, with the exception of 2011 when there was no YRBSS. Lifetime vapor use data was only available in 2015, 2017, and 2019. Lifetime cigarette use and RVR percentages have a slightly significant relationship. The p-value is 0.049, which is almost 0.05, so it's only a slightly significant relationship. There is not a statistically significant relationship between lifetime vapor product use and RVR percentage because the p-value is greater than 0.05. Strategic plan can target retailers by educating them on tobacco sales, which is the first goal of the strategic plan. Only time will tell if the implementation of the Synar Amendment will have an effect on lifetime vapor product use because there's only 6 years worth of data. Two recommendations based off this project are future studies could be focused on the rate of youth who obtain tobacco products from retail stores and evaluate whether or not youth are receiving their tobacco products from retail stores or elsewhere. This is important because youth, they know if they're not allowed to get tobacco products from stores and they're just going to go ask their friends if they want some, so it's important to keep that in mind. The outcome of the strategic plan is the development of a strategic plan that will guide Nevada on how to better implement the Synar Amendment. The linear regression highlighted that work needs to be done to effectively evaluate the Synar Amendment's effect on youth tobacco use for years to come. I would like to thank DPBH for the opportunities I've been given, and to my preceptors, Tracy Palmer, for allowing me to intern at DPBH, and Kim Sloan for working on these projects with me. I would like to thank the Western Regional Public Health Training Center for this opportunity, and I would like to thank the University of Nevada, Reno School of Social Work for allowing me to be in the Bachelor's of Social Work program.